again, I would like to introduce you and welcome you to our webinar for today, which is going to be about occupational therapy and low vision, how to live safely with vision loss. And it's going to be presented by Teresa Bayer and Claire Grennall, occupational therapists from Guide Dogs New South Wales, ACT. So Teresa has been an occupational therapist with Guide Dogs New South Wales, ACT for over 2 years. She currently provides services to clients in the Sydney Metro North region. Claire is an occupational therapist and orientation mobility specialist and has worked with Guide Dogs New South Wales ACT for the past 3.5 years. She's based in Sydney and supports clients in the Metro North region. Prior to this, Claire has worked as an OT in community rehabilitation teams with a focus on stroke rehabilitation and on the Central Coast in New South Wales and in the UK. So thank you so much, Teresa and Claire, for joining us today. I can't wait to hear what you both have to say.
Thanks so much, Delaney. We're just going to share our screen now with our PowerPoint slides, so just bear with us for a moment. Delaney, can you please let me know if you can see our
perfect.
slides? Yes. Beautiful. Thank you so much.
Thank you.
So again, just a quick introduction. I am Claire and I'm an occupational therapist and orientation and mobility specialist with Guide Dogs based in Sydney. And I'm presenting with my lovely colleague, Teresa Bayer, today, who is also an OT in the North Sydney region. So today's presentation is all about occupational therapy and how people with low vision and blindness can live as independently as possible in their everyday activities. So throughout today's presentation, we hope to share a little bit more information on exactly what occupational therapy is and what occupational therapists at Guide Dogs can do to support people with low vision and blindness. For the purpose of today's presentation, we will be focusing on the most common macular disease, age-related macular degeneration. We'll be discussing the most common functional difficulties people with AMD experience, as well as some of the interventions that we often support clients in accessing to maximise their independence in daily routines. We have also prepared a short case study at the end of the presentation, which will hopefully be a great way just to summarise what we have shared today and give some more context around Guide Dogs OT services. And at the end, we will have some time to talk through how you can refer yourselves to access Guide Dogs services, as well as any questions that you may have. So in a nutshell, occupational therapy is all about supporting people to live independent lives and engage in those activities that are most meaningful to them. At Guide Dogs, we support people with low vision and blindness to do exactly that. When you hear about OT, you may hear a term known as activities of daily living, or ADLs. And this is just an umbrella term that breaks down those everyday activities that you do in your day-to-day life. These can be broken down into self-care, which includes dressing, showering, personal grooming, meal preparation, home management, for example, cleaning, laundry, and yard maintenance, communication skills, so the ability to use a phone, computers, and financial management. Here at Guide Dogs, we work with clients aged 7 years and over with various types of vision conditions and at all different levels of functional vision. We can provide service via telepractice as well as in person.
So as Claire was saying, we're going to focus mainly on age-related macular degeneration today. So age-related macular degeneration is a chronic disease of the macula, which is the area at the very centre of the retina, which is at the back of the eye. So this results in progressive loss of central vision, which results in peripheral vision remaining intact. This is also known as tunnel vision. Some of the functional changes will differ from person to person based on the stage of diagnosis and the presence of any additional eye conditions. So some of the common reasons for referrals that we receive for occupational therapy services in regards to AMD, it really is dependent on the level of vision that the client has and also their goals. So some of the common referral reasons we come across that are some of those day-to-day activities that clients have difficulties with include making a cup of tea or coffee in the morning, watching TV with their family, preparing meals, in particular using their household appliances, being able to read dials and click on some of the control panels, and of course using their mobile phone, landline phone, and some remotes around the house, such as a TV remote. Some other issues that people face include recognising other people's faces, you reading clocks and being able to tell time. And however, there are many options out there and solutions in order to maintain your independence, and with the right adaptations to what you do and how you do it is really what we look at as OTs. So here we have a few slides just showing a photo of everyday objects and things around the house and just simulating what it would appear like to someone who had AMD. So on the screen, I just have a picture of someone looking at a wristwatch. So on the image to the left, the wristwatch is showing, simulating what it would be like for someone in the initial stages of AMD. So the watch face is slightly warped, making it very difficult to tell where the minute and the hour hands sit. And on the right side, we have an image of the same wristwatch with the advanced stages of AMD. It's quite blotchy and very difficult to tell where the hour and minute hands are on the watch. So on the next slide here, we just have two photos of a TV remote. On the left, we have the simulating what it would be like in the early stages of AMD. There's a bit of warping in the middle of the image, making it very difficult for someone to be able to select the right numbered button if they wanted to change the channel. And of course, on the right-hand side, we have showing the advanced stages of AMD. So there's quite a lot of warping in the middle of the image where the kind of number dials are, and of course a bit of blurring up the top where the power button is, and down the bottom as well. So of course it would be quite difficult for someone to navigate through their TV remote and tell which button they were selecting depending on what level they were at. I also have images here of the microwave control panel. So on the left-hand side, we have the initial stages of AMD. There's quite a lot of warping around some of the metal buttons, especially around the auto functions and some of the numbers, making it quite difficult to punch in those numbers. And on the right side, we have simulated what it would be like for the advanced stages of AMD. Quite a lot of blurring around the LCD screen, a lot of blurring around the bottom where the cancel and the start button, and a lot of warping around that middle area. So this is just demonstrating what it would be like for someone with AMD to look at these household appliances and everyday items and how their vision would make a lot of functional impacts.
So for anybody that is experiencing any of those functional difficulties that Teresa just mentioned, they can contact Guide Dogs, and upon initial contact, an OT referral will be submitted. Following an OT referral being received by myself or Teresa or one of our other OTs, we will contact you to arrange what we call our OT initial assessment. And this is really just a great opportunity for us to have a really comprehensive discussion with you about your daily routines and all those activities that you do within your day that you're managing well, but also those that you're finding difficult to do independently because of your change in vision. For me personally, I really like just to talk through a typical day for a client, starting at when they wake up in the morning, how they fix themselves breakfast, make a cup of tea, get dressed, attend to any of their household maintenance activities, engage in really important, meaningful leisure pursuits like social interactions, attending volunteer groups, spending time with family, grandchildren. And I feel like that's a really great way just to get a really holistic understanding of the client, what they're finding difficult, which then in turn helps me work with them to identify goals and possible solutions to help them be more independent in their everyday life. For some clients, it can be a little bit difficult for them to really pinpoint where the barriers might be or where the difficulty lies in an activity and what is preventing them from being able to do it more easily. And in those instances, we will complete what we call a functional assessment. And this is just a chance for us to observe you complete a task, for example, making a cup of tea, and really just break down all the steps of the task and identify where the difficulties might lie, again, helping us know what solutions we might be able to talk through with you to help you be more independent and confident doing that activity. In my experience, I've also found that the home environment can really be conducive to someone feeling confident and independent living at home if it is set up correctly and to the needs of the client themselves. We do know that people with low vision and blindness are more at risk of having falls and injury resulting from those falls. So another really important part of our role is what we call a home environment minor modification assessment. And again, this is a chance for us to come to your home, walk through the home and identify, again, what is set up really well, but what are some environmental barriers that might be stopping you from feeling confident and independent in managing at home. So for example, some really basic strategies are the removal of any trip hazards, for example, rugs that aren't fixed to the floor, making sure that the hallways and paths are clear from any clutter that might present as a trip hazard. We also look at installing grab rails in places like the bathroom to improve your confidence and steadiness, as well as at the front and back access of the home. I've often talked to clients about installing high contrast treading on the edges of steps just to really help differentiate each step from the next. And the reason for that will hopefully become a bit more clear later in the presentation with some images that I will share also. For some people, lighting in the home can really make it easier for them to use their functional vision, but it can also make it more difficult if the lighting isn't enough or is too much. And where lighting has been identified as a concern, we can complete our lighting assessment. And we would come to your home, we would test the levels of lighting in different areas of the home. And this helps us understand if more lighting is required or less lighting would be of benefit for glare management, for example. In my experience, the most common areas of the home where more lighting is required is often above the kitchen bench top where you might be preparing a meal, so chopping ingredients for meals. In a wardrobe to be able to identify the colour of clothing that you want and the correct item of clothing. In the pantry to retrieve any ingredients and utensils that you might be using for meal prep, as well as in the bathroom for grooming, so makeup application or shaving. I will note that not all of these assessments are required for every person that we work with, and the assessments that we select are really dependent on the functional difficulties the client is experiencing and their goals for their OT service provision.
So as Claire's just gone through about our assessment process, once the client has figured out with the OT what their priority goals are, we're able to start on intervention. This is very dependent on the client's level of vision, any additional needs they have, and of course what their priorities are. So we try and be as client-centered in our approach as possible, and we usually go with exactly what is the main goal that someone would like to achieve out of services with us. Often it's in relation to being safer, more confident with those day-to-day activities. So our main kind of goal is, of course, in particular with AMD, would to have everything bigger, bolder and brighter. So this is all about enhancing someone's functional vision and using what they have left over in order to complete those day-to-day activities, be as safe as possible. So some of the ways we would start intervention and some solutions we would find after completing our assessment would be in relation to modifying someone's environment. So this could be through using contrast, as Claire went through, certain modifications to the client's home with grab rails to make it safer. Looking at trip hazards, how could we remove anything that could be tripped on? Looking into lighting, of course, anything to enhance someone's functional vision, and of course organisation, making sure everything's easy to grab, those frequently used items are in sensible places, are just some of the ways that we could modify the environment. Looking into modifying the activity, something we look at as well, that could be if someone was having difficulty with cutting and chopping up vegetables, could we look into having some pre-cut vegetables that you can purchase at the supermarket? If someone's having a lot of difficulty using their stovetop and they're looking into other solutions, could we look into microwave meals and increase independence in using the microwave? And another option might be if someone's having some difficulties steaming their vegetables on the stovetop, could we look at putting it in a container, microwaving it instead? They're just a few options and examples of ways we could modify the activity. Another option that we have, of course, and we often incorporate into intervention, is to look into daily living aids and equipment. So this could be anything such as, talking appliances for the kitchen, possibly talking clocks, anything that will really enhance someone's functional vision, and also using audio where possible are usually what we really look at and hone in on with intervention.
So we have put together a case study which will hopefully give a bit more context to what we've shared so far in terms of assessment and intervention. So for this case study, we have a 70-year-old lady with macular degeneration, but she has experienced a change in vision. So it has started to progress, making it more difficult for her some of her everyday activities. She lives with her husband and she is a My Aged Care client. So the initial reason for referral for this client was around difficulties with making a cup of tea, specifically around overpouring. So throughout our initial OT assessment and our functional assessment, we were able to ascertain that she wasn't able to identify the line of water once she was pouring it from the kettle into the cup, resulting in her overpouring the water. This is not only a risk in terms of burns, but also for slips and trips if she was to spill the water onto the floor and not be able to identify it to clean it up. So throughout our initial assessment, we also spoke with the client about some other areas where she was struggling, and she mentioned that it was difficult for her to see people's faces, which was often embarrassing for her, particularly when speaking with someone that she did know and watching TV. She is an avid cook and she really enjoys spending cooking time with her family, but has become more hesitant of late around chopping and the fear of cutting her finger as a result of her changing vision. So to provide a bit more understanding about what this client might be experiencing, we have shared some more pictures that simulate the initial stages of macular degeneration and the more advanced type. So on the left, we have a picture of a young man from the waist up. He's facing the camera front on, and you will notice that his face itself has started to become distorted, almost in an S shape across his nose and around his chin. So you can still pick up some of the features of his face, like his eyes, his hair, his mouth, but it's not a perfect image, starting to make it difficult to recognise exactly who it is. You will also note that the edges of the photo have also started to blur, so that peripheral vision has come into play as well and started to change. On the right of the screen, we have a photo of the same young man, but this time it's zoomed in, so from the chest up. And you'll notice that with the advanced stages, this young man's face is significantly more distorted. We've got almost like a spiral effect in the center of his face with some grayed out coloring, and it's really difficult to make out the finer features of his face, including his eyes, nose and mouth. They're almost not visible at all. Next up, we have photos of someone chopping a carrot on a wooden chopping board. So again, on the left, we have a photo of the initial stages of AMD. You'll notice that the carrot itself, the color is quite good, but there is a significant distortion in terms of the shape of the carrot. And again, it's reflecting that S shape. So you can start to imagine how it would be difficult for someone with both the initial and advanced stages of MT to feel confident in chopping and not feeling at risk of nicking their finger. On the right of the screen, we have the same photo, but again, the advanced stage is replicated. And you'll notice, again, we have that really significant spiral effect in the middle of the board to the point where the carrot is almost not visible. And you've got the grayed out yellow colouring over where the carrot is, which makes it really difficult to identify where one should position their fingers and how far away the knife actually is from their fingers when chopping. The final images here demonstrate why this client in this case study might have some difficulty with pouring a cup of tea and knowing when to stop pouring. On the left, we have an image of a white cup on a beige bench top and a white kettle pouring into this cup. The peripheral edges of the photo are slightly blurred, and the cup itself has a bit of a distorted edge. It still is a whole edge, no part is missing, but it is distorted, making it difficult to know exactly where to position the spout of the kettle onto the edge of the cup to pour. And on the right of the screen, we have the advanced stages of MD. This cup is significantly more distorted than the initial stages. You'll note that there's almost a section of the cup that appears to be missing at the back of the cup, closer to the tile wall. And again, where the kettle spout is coming to the edge of the cup, it's really distorted. We've got that spiral effect again and the grayed out yellowy colouring and patching, which makes it really difficult to not only know where to align the spout of the kettle to the cup edge, but also to see what is in the cup and what level that water of the cup is at.
So after we have completed an assessment with this client and we've identified some of those key priority areas for her and the difficulties that she is currently having, we look into what solutions could be discussed to find what is going to work best for this client. So some of the options discussed in relation to difficulties she's been having with pouring drinks, a few examples of some intervention we suggested were a liquid level indicator. I do have a video I will present in relation to how this works, but it's just a aid that can sit on the very edge of the cup and will beep when water reaches close to the very top of the cup. This assists with knowing when to stop pouring and also avoid spills, which can lead to slips and other sort of safety related issues, especially with hot water. Burns is something that a lot of clients are very worried about. Another option discussed was hot water dispenser, having a brand new appliance that could just straight away pour some boiling water into a cup. Another option discussed was pouring some cold water into a cup and heating this in the microwave. Another option is to really enhance that functional vision through changing the colour of the cup to make it stand out a lot more against the liquid that's being poured in. And another option discussed was pouring over the sink in case of spillage, again, just minimising the safety risks involved with working with hot water and avoid any sort of spills onto the floor. So they're just a few options for this particular issue that the client was facing. So on the left here, I just have a video demonstrating how a liquid level indicator works. So this is something that we often recommend to clients who are experiencing difficulties pouring drinks. as a lot of people do say they find it very difficult to tell when the water has reached the top of the cup, especially when they're making tea and coffee and they have to add multiple liquids in. This is a really helpful aid that will help with this. So it's the one demonstrated in the video that I will play shortly. It is just a blue dual sensor liquid level indicator. It has a large battery pack, kind of shaped like a rectangle, and on the very top it has a speaker. On the back of it, it has 3 prongs. 2 are long and 1 is short. These prongs just sit on the very inside of the cup. The battery pack sits on the outside, and when the client is to pour in water, it will then beep when the water reaches those prongs. So what I'll do is I'll just play the video and I'll speak to it as it's playing for those having any sort of difficulty watching it. So on the bench top, it has a white mug, liquid level indicator, just picking it up and showing what it looks like, 3 prongs. There's also a kettle. So I'm just placing the liquid level indicator on the very edge of the cup, far on the other side of the cup from where we'll be pouring from. So it's close to the handle. And then pouring the water from the kettle, making contact with the spout to the cup, and pouring until it reaches the prongs of the liquid level indicator, and you'll hear it beep. And in order to get it to stop, all you do is lift it out of the water. So this is a very quick and easy daily living aid that we could introduce for this client, and will hopefully solve that issue in relation to pouring drinks, along with going over some other options if this wasn't right for her. So another one of the issues that this particular client was facing was in regards to recognising people's faces. So some of the solutions that we looked at was in relation to having a low vision badge and also talking through some self-advocacy strategies. So the low vision badge is just something that the client could wear to indicate to someone just reading the badge that she has low vision. And this would help with family and friends or strangers meeting her for the first time or meeting her out in public and wondering maybe why she hasn't recognised them and waved to them. So that's just something that could be implemented along with self-advocacy strategies, just explaining that due to her low vision, she does have difficulties recognising people's faces and maybe just describing what she sees when she looks at someone, and some strategies that family, friends and people could utilise when coming up to her and interacting with her, that some visual cues might not be picked up by her. And it's very important to introduce yourself to her, even if you've met her plenty of times, just so she knows exactly who she's speaking to. So one of the last occupational performance issues that she identified was in relation to meal preparation, and she was quite nervous about cutting her fingers. So some of the intervention that we'd look at would be in regards to a finger guard. So there's one picture just below, someone utilising a finger guard when chopping up some chili. So it's just a sheet of metal that essentially just sits in front of the fingers, stabilising the piece of food that's being cut up. And this just provides a little bit of extra material in between the fingers and the knife, giving a little bit of safety. Another option we look into is lighting. Could we increase the lighting in her kitchen to make it a lot easier for her to use her functional vision to view what she's chopping, because often it can be quite dark in some of those areas of the kitchen at different parts of the day. Another option we look into is cut-resistant gloves. There is just below an image of someone wearing a cut-resistant glove, holding a piece of capsicum and cutting it with their other hand on a beige chopping board. So that, again, like the finger guard, just provides another option of something that could be worn. On the other hand, that isn't holding the knife, just to provide a little bit of material in between the knife and their fingers. Another option we can look into is pre-cut vegetables. So just changing the activity. So potentially just having a lot of anxiety around cutting. Potentially some vegetables could be pre-cut and purchased from the shops. Which would mean she wouldn't have to cut up as many things. So it just depends on what that client would like to do with each recipe that they're making. Another option we look into is alternative chopping techniques. An example of that could be cutting around vegetables such as a tomato in half, so that there is a flat base to put onto the chopping board rather than it rolling around and being really hard to stabilize. So that could be an alternative chopping technique that this client could use. And another option is a contrast chopping board. So having a dark coloured vegetable or fruit against a light chopping board, or vice versa, just making things stand out, and again making things bigger, brighter, and really kind of standing out.
So throughout our initial assessment, our OT assessment, the client also made mention that when she goes out and about with family, she has become more hesitant on stairs. And I mentioned the benefits of high contrast step treading in an earlier slide, and hopefully these images will help explain why they are of benefit. So on the left, we have a set of about 10 steps going down. There's a rail on the left. The steps are coloured grey, and each step tread has a darker black strip, providing a bit more contrast to help differentiate each step from the next. But you will notice that advanced stage macular degeneration is reflected in this picture. And again, the steps themselves are really wavy. There's no straight edge into the steps. So you can imagine walking down those steps without a mobility aid of sorts. It'll be really difficult to know when the next step actually is and when the steps end themselves. On the right, we have the same set of steps, but this time we've got the view of looking up the steps on approach. You do have the black contrast strip that you can just make out on the top edge of the step. But again, the steps themselves, the edging is really wavy. You've got that grey colouring, making it really difficult, again, to discern each step from the next. I have put my O&M hat on here, and I do know that although it's not a difficulty for this client at this point in time, that often clients with AMD have some difficulty also reading street signs, the timetables at train stations, and also recognising bus numbers on approach. So there are other things that I perhaps would think about asking the client to see if she's having difficulty with those and what some strategies are to better support her in her community mobility. And again, throughout our discussion, she also made mention that she's having a bit more difficulty reading the mail and watching television. So in addition to the OT goals that Teresa's spoken through, we have identified some orientation and mobility goals, as well as some low vision goals. And that would result in a referral to both of these specialists also to provide a bit more assessment and support to this client to help her be independent, not only at home, but also help her feel more confident and independent getting out and about and participating in life to the best of her ability. So to summarise what we've discussed so far, it is really important to note that everyone's experience with low vision is different, and this will really be dependent on the type of vision condition you have, the level of functional vision you have, and also the goals that you want to be more independent in. Despite the level of vision you have, there are always options that we can talk through with you to help you be as independent as possible in those daily activities. And what comes to mind for me when I think of those solutions are the three words: bigger, bolder, brighter. So can the activity be made bigger through magnification or large print? Can we make the activity bolder through colour contrast and lighting to make it brighter as well? The name guide dogs is a little bit misleading. So I would like just to make a mention here that as well as guide dog mobility, we provide our OT services, which we have discussed, but also orientation and low vision services, where you can be assessed across a multitude of areas in your everyday and provided support in. Sometimes people aren't quite sure if we can help them, and that's okay. If this is you, feel free to give us a call and talk through what isn't working so well for you, and we can hopefully discuss which of our services might be of benefit to you, or if not, link you in with another organisation or support that can help you.
So how can you refer if you yourself, someone you know, or someone you're working with might benefit from guide dog services? So you can refer either through calling our number, which is 1800 436 364, or you can visit our guide dogs website. There is a menu toggle that you can click on along with a make a referral. Fill out a few questions just about yourself or the person who is you're referring to guide dogs, and a member of our team will be able to get in contact and talk about what the next steps are. So some questions we get are around funding. How does it all work? Some of the main kind of funding streams we go through for services include the National Disability Insurance Scheme, My Aged Care, and Department of Veteran Affairs. So due to having low vision, you may be eligible for government funding in order to access vision services. However, if you need support accessing these funding options, want to know how to kind of get started, or maybe you know that you're not eligible, you've already tried, please still get in contact with us and we can still discuss what options to get you started and engage with services. So that was our presentation, and we will pass it back to Delaney.
Thanks so much, Teresa and Claire. That was very, very informative, especially the video of the liquid level indicator. It's great to see how something like that works in real life. So thank you very much for that. We do have quite a few questions coming through. Just for everyone, a reminder of how to pop questions through. So again, there is a black panel at the bottom of your screen, and one of the icons in the middle of that panel is a Q&A icon, which I have circled in red on the screen. Once you click that, it will bring up a white rectangle where you can type your question in and send it through. Again, if you would like to send it anonymously, you can click the send anonymously box and then select send. But again, only myself and Teresa and Claire can see it. So, you know, no such thing as a silly question. It's all good. Send everything in. Before we do get into the questions, however, I did want to talk very quickly about the Macular Disease Foundation Australia. We have a goal to try and reduce the incidence and impact of macular disease, and we try to do this through our 4 pillars. The first pillar being prevention and early detection. So we provide current, accurate, ongoing information to try and increase the awareness of macular diseases in Australia. And we reached over 7,000 people last year. We're hoping to do even more this year. Secondly, support and services. So we provide support for the entire macular community, and we also facilitate support to other services. I'll talk a little bit more about this in a moment. Voice of the macular disease community. It is our privilege to try and advocate on the best interests for the macular community, whether it be designing policies for state and federal government or to make sure that benefits are not cut. Some of you may have seen our 47K Reasons campaign. If you would like to be part of it, please go onto our website. And of course, research and data. So 100% of funds donated to research go directly into our research grants program. Since 2011, we've actually donated over $5 million to 29 different research projects, all in the hope of trying to find a cure for macular diseases. Now, in terms of support and services, this is how we can help you. On the screen there is our helpline. That's not just for IT problems or webinars, but if you have any questions, not just about AMD, but if you have questions about diabetic eye disease, my aged care, Medicare, even transport to get to your eye appointments, we can help you with all of that. So you can give that helpline number a call, which is 1800 111 709. If not, you can also email us with any questions or queries that you might have at education@mdfoundation.com.au, or there's a whole lot of services and resources available on our website, which is www.mdfoundation.com.au. And just a reminder that everything that we provide is for free. So any questions that you might have, please do reach out. All right, so at the end of this webinar, you will be receiving an email in your inbox. It should arrive about an hour or so after we finish the webinar. In that email, you'll find a few different links. One of the links will be to a feedback survey. If you could fill that out, that would be really great. That just allows us to get a little bit of feedback on the survey, on the webinar, and how we can improve. We will also include a link to previous webinars that we have recorded and posted up so you can access them. And finally, there will also be a link to future webinars. And speaking of future webinars, our next one is going to be on Tuesday, May 24th, from 2 to 3 p.m. And this is actually going to be a Macular Month webinar. So every single year in the month of May, we hold Macular Month, where we try to increase the awareness of macular diseases even further. And this particular webinar is going to be a Q&A session where it's Ask a Patient and an Optometrist. So everything you want to know about diagnosing macular conditions and what to expect when receiving sight-saving treatment. And we're going to be joined today on that day by MDFA's very own volunteer, Val Nicholson, and optometrist Victoria Heaton. So we might get to the questions now, Teresa and Clay, if that's all right. So the first question is, oh, sorry, let me just bring them up. Are audio or spoken large digital glucose monitors available for people living with diabetes?
Thanks, Delaney. Yes, I believe there are. I haven't personally used them in my practice, but I do think they are available. I do know that some clients also use their phones with a patch, and that can speak to their phone, and they can use voiceover on the phone as well to read out their glucose readings also. I'm not 100% sure where they can be purchased from. My first point of call would be perhaps with the clinical nurse specialist that you're working with for diabetes management. But if it's something the viewers are really interested in, I'm happy to do a bit more digging, and I can send you through some info that we come across as well from other colleagues that might have some more experience.
Sure. So the attendee that sent through the question, you have sent it through anonymously, but if you'd like to contact us, again, through education@mdfoundation.com.au, I'll just forward that through to Teresa and Claire, and they'll be able to provide you with a bit more information. Next question, do you have an online shop to purchase these sort of items, so such as a liquid level indicator?
Unfortunately, at Guide Dogs, we don't sell these particular daily living aids. We do sell some items on our website, such as large print calendars and a few different kind of fundraising merchandise. So we often are reaching out to our low vision aid suppliers and places that do sell this particular equipment. So whenever we do recommend anything, we usually source it or are able to go out to some showrooms and be able to try it with the client, or really guide them in the right direction of where they can purchase these items once they're recommended.
Perfect. And I think this webinar is available nationally. So if you are outside of New South Wales, there are other low vision organisations that could be available for you. So if you're in Queensland, for example, Queensland Blind Association, and so on and so forth. So you can go to your respective organisations. So I think you both touched on this previously, but I might ask it again just because a few people have asked. Can we refer ourselves, or do we need a health professional to refer us?
You can absolutely refer yourselves. That's almost even better for us, because we get to hear directly from you what is working well and what isn't working so well. We can put it up on the screen again in a moment, but it's just through our contact phone number or online. If you're caring for someone with a vision impairment and you feel like our services might be of benefit to them as well, you can refer on their behalf through those channels as well, provided that they've given you consent and they're aware that the referral has been submitted also.
Perfect. This is a slightly specific one. Do you think that tactile dots can help with buttons on different equipment? And if so, where can I get them?
Yeah, definitely. So with tactile dots, they can be placed on a range of different equipment. I showed a few different household appliances and remotes, things that would really benefit from maybe having tactile dots. So something maybe like the microwave is something we often put tactile markers on, something to make it bigger, bolder, brighter, something to make those buttons really kind of stand out. And for those who are entering maybe the more advanced stages of vision loss, giving them something tactile that they could remember exactly what setting there is. So definitely tactile dots can help with buttons on equipment. Something just to keep in mind is sometimes they do their adhesive backing, so just making sure that you have some spares, or potentially just wiping down whatever you're sticking it onto to make sure it can stick on there for as long as possible. There's also some other options, such as using some 3D puff paint, something a little bit more permanent that we can look at as well. This is often really helpful for things that are close to maybe heat, where maybe heat on a particular appliance will mean that it's more likely that the adhesive will come off. So something like that can provide a bit more of a permanent solution. These can either be provided through maybe your vision specialist, such as OTs, or you can purchase them in packs from a vision supply store. So it really kind of depends. If you have people around the house that could help you stick them on the right settings, you can purchase your own, but definitely having a specialist maybe guide you first, such as an OT, is really important as well.
Perfect. So some really great options there. The next question, I might actually take this one if that's all right. Does age-related macular degeneration lead to total black blindness? So I think Teresa and Claire, you both touched on this. The macula is right at the back of the eye, and it's only responsible for central vision. So it doesn't have any impact on the peripheral vision. So even in the very, very late stages of AMD, and if you only have AMD, you're never, ever going to wake up black blind. That will not happen, because only that central section of vision is affected. The next question is it better to have warm or cool lighting in the house?
It's a great question. And look, I often find it's personal preference, to be honest. So typically in our kits, we're a bit like Mary Poppins. We come out with these kits and can pull out all sorts of gadgets, but we carry some different types of lighting, such as the warm and cool lighting. And in the home, we'll actually put it in place and let the client tell us what they like about it, what they don't like about it, and go from there in terms of which we would recommend for the client.
Yeah, and it really depends from room to room as well. Some people prefer to have warmer lighting, a bit more yellow in some of the bedrooms, and then in some of the areas of the house, like maybe the study or the kitchen, they want to have that cool lighting. So it really is personal preference and what's going to work for that area that they're trying to illuminate.
Right. And I might just finish off. This is more of I think, a statement than a question, but someone said that I thought Guide Dogs New South Wales was just about guide dogs, but it's great to see that they do a lot of other low vision services. But yeah, thank you very, very much, Teresa and Claire, for joining us today. And especially today on International Guide Dogs Day as well.
Thank you for having us.
Of course, it was so great to hear all the different things that you can do, in everyday life, just simple things that can make, a big difference for someone whose vision has been affected by a condition such as AMD. So thank you very much both for joining us. And if anyone does have any further questions, say you think of a question after the webinar, please feel free to send it in and we can forward that through. So thank you again. And thank you to all the attendees for joining us as well. And hopefully we'll see you at our next webinar. Thank you very much.